Welcome to All Things Simplified. Today we will discuss mitral valve prolapse and location of its murmur using our knowledge of anatomy and pathophysiology. Mitral prolapse is the bulging of mitral leaflets into atrium during systole. Mitral valve prolapse is the most common cause of mitral regurgitation. One will ask, why is the murmur mid to late systolic? Let's visualize the mitral valve ejecting blood into the left ventricle during systole. Initially, it carries out the normal function, but when the prolapsing leaflet abruptly reaches its limit after systole, a click is heard mid to late systolic after ventricular ejection, when the valve actually loses tension and prolapses. Keep in mind, as the ventricle is filled with blood, those leaflets gathered tension, but during ventricle ejection, the leaflet loses tension, causing papillary muscle to prolapse into atrium. It is safe to say in mitral valve prolapse, an increase in volume decrease murmur. This creates leaflet tension, causing no murmur produced, and a decreased volume increases murmur. Lack of tension created a clicking sound or murmur. In other words, decrease venous return to heart with standing due to gravity, murmur will intensify. Less volume, leaflet prolapse due to lack of tension, producing a murmur. Squatting increases venous return of blood to heart. More volume of blood decrease murmur intensity. More volume created leaflet tension equals no murmurs. In regard to where one will hear mitral prolapse is simple. The mitral valve sits closest to the chest wall at the cardiac apex. Hence, mitral valve pathology or murmur is best heard at the apex. This is the only murmur with a click and most common in women.